You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. On today's program, we will be discussing a new injection technique that literally melts or dissolves fat off the body. It's called lipotherapy. If you have unwanted fat on your body that is not responding to diet and exercise, my advice, stick around. The latest edition of the Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Deborah Hudak. Dr. Hudak is the medical director and founder of All About Aesthetics in Raleigh, North Carolina. We've invited her on the program today to discuss lipotherapy, a procedure that actually melts fat off the body with a simple injection. Dr. Hudak, welcome to the program.
Thank you. I really appreciate being here.
Now, I understand you are the only person in Raleigh that is doing this lipotherapy.
That is true. That is true.
So fairly a new procedure.
It is actually not a new procedure insofar as it's been around since 1952 in Paris, France.
Okay.
But it's new to the Raleigh, North Carolina area, and it's really pretty new to the United States for less than 5 years' time. It's really taken off from what I understand in LA at this point in time.
Yeah, big celebrity procedure,
yes.
You say.
Yes.
Okay, now for those people that don't know All About Aesthetics, what kind of patients are you seeing there?
Well, the patients that I see for surgical purposes are mostly people who need surgeries of the eyelids, the brows, the midface. Those are the areas that I specialize in.
Okay, now I've been told you built your reputation on the eyes.
Mostly the lids.
When somebody wants a natural-looking eyes, it's called a blepharoplasty, they go to you.
That's correct, and they also come to me for more difficult procedures, where I shorten tendons of muscles that lift the lids, take care of very droopy lower lids, all that sort of thing, with a total reconstruction of lids.
Now you have estheticians that work there.
Yes, I
mean,
do.
everything, injectables, you're doing just about everything. Is it like a medical spa?
It is.
How do you describe it? Is that what it is?
It's a place where you can go where everything is physician-directed, as in I oversee any of the procedures that have to do with the lasers for hair removal, vein removal, pigment removal, tightening of the skin, all those with lasers, as well as making skin healthier so that any procedure we do, particularly the minimally invasive procedures, you're going to get more bang for your buck, and the procedure is going to have more of an effect that's going to last longer. So that's always a nice investment for the person. Plus, when you have healthier skin, it's more beautiful.
Now, you seem to walk your talk. You use some of this
stuff?
stuff?
Oh, I do. Absolutely.
Because I know your age. You told me off camera, and you look at least 10 years younger.
Well, I appreciate that.
Than your age.
Thank you.
So that's good. Now, we invited you on the program today to talk about this lipotherapy. I mean, you're actually I said at the top of the show, is that true? You inject the fat
into the skin,
and it melts the fat off. Kills the fat.
Kills the fat. And the important thing you have to realize is that you only reproduce fat in your life twice, 9 months of age and 12 years of age. Any other reproduction of the individual fat cells would be in the form of a benign fatty tumor or lipoma. Okay. Each individual fat cell can enlarge, but you don't actually grow new fat cells. So if a person is down to their frustration fat, that fat that you already alluded to, that they've been trying to diet and exercise, just can't get rid of it. Okay. This is when we can go in, inject into the skin with very tiny needles, put a medicine in there that will literally kill the fat cell. And again, it's never going to be reproduced. So
one of the things you said on the phone, you said there's only two ways to really get rid of fat. Expand on that.
Well, there's surgical excision, and along with that, another surgical way is with liposuction, or smart lipo, where they're using a laser. Okay. Now, in both of those procedures, those surgical procedures, there is a very rare risk, but a risk nevertheless, of death. Okay. You also have a much longer post-op period of time, far more discomfort than would a Tylenol Extra Strength would take care of, which it does take care of in the case of lipotherapy. So we have something that people are really looking for.
Will this take the place of liposuction?
I think absolutely. In fact, in
many
places...
What about results, though? That's the part I'm very skeptical about.
The results, you have to see them to believe them, but you can see them for sure.
We'll get to your photos in a moment.
Okay.
To show the photos. But first
of all... The neat thing is, another thing that is a definite advantage over your liposuctions and your smart lipos is this actually has an element of skin tightening. Okay. There is enough inflammation from the death of the fat cells that there is a response by the body's immune system to heal it over, which causes us to have new collagen and elastin made. And there's been shown through studies by Dr. Diane Duncan in Fort Collins, Colorado, of having at least 14% skin tightening per session in an area.
What are the different areas of the body people are coming in for this?
Well, they're coming in for lots of areas, and I'll go really from the top of the head on down. The lower lid fat pads, the jowls, and under the chin.
Is that right?
Mm-hmm. Can also even reduce marionette lines and these nasolabial folds by properly placed injections in the correct amounts. Going down further, the axillary fat pads, a lot of women get right in front of their bras. The upper arms,
so what do you
those
mean about
bat
that
wings.
part? What part are we talking about?
Well,
a little fat they get in the crease of their arm?
That's right in here.
Interesting.
Okay, another place people have it done is the upper abdomen, the lower abdomen. You can even carve out a six-pack. Again, there is an art to it.
Sounds like an exaggeration.
It can be done. It really can.
Is that right?
It's very cool, yes.
Okay, so love handles.
Love handles, back rolls, flanks, and then all four sides of the thighs. Outer thighs, inner thighs, front thighs, back thighs, and knees.
Cellulite. What about cellulite?
Cellulite, the only way that the FDA has said that you can permanently get rid of cellulite is with lipotherapy, mesotherapy. And I combine the two because
it sounds like, though, that every woman everyone that has cellulite wants to get rid of it.
Absolutely.
That's
it's
a
unsightly.
Fact. And you're saying that this gets rid of it. Why isn't everybody doing it? Why isn't everyone doing it?
Because they're not even aware of it.
They're not aware.
Exactly.
Okay, not an overstatement on your part.
Not at all.
And so you just inject it, and this solution melts or kills the fat. Where does the fat go?
Well, it's in the tissues where it was just killed, and then our body has these little cells, I call them the vulture cells. Okay. They're macrophages. They're big eaters. Macro means big, phage means to eat. And they go out of the circulation. They go to the area of the dead fat cells, because that's what they do. They look for things that are dead. They eat all these dead fat cells. They go back into the circulation through the kidneys. They divulge their contents, and then they go about looking for something new that's dead to eat.
Okay.
So that's how it's gone.
And the downtime?
There is virtually no downtime. People are going to have a tremendous amount of swelling in the first 2 to 3 days. And we want to encourage them to not do anything to impede that swelling, because the more swelling they get, the more skin tightening they get.
Okay.
So they maybe feel like they don't necessarily want to go out and have dinner with their friends right after this. However, they can go out, they can do anything, they can do their work at home, they can do their work at work, they can get about. They just have to realize they are going to have swelling in the area that was treated for 2 to 3 days, but it doesn't slow them down any further than that.
What about the saddlebag area? I know a runner.
Yes.
Runs. The little area, can't get rid of it. You didn't mention saddlebags.
That's actually the outer thighs and then going up into the area of the love handles. It's that area in between. How does it work?
How does it work? I mean, it's a great place.
That area is a little tougher. It usually takes 3 to 5 treatment sessions, but does do a beautiful job.
And these are 15-minute, half-hour treatments?
That is correct.
So 3 to 5, 15, 20-minute treatments, they're gone.
That's correct.
Okay, and the fat doesn't, just like liposuction, fat doesn't return.
That's right.
So the cells are gone.
But this gets skin tightening that the other doesn't get, and it doesn't have near the amount of pain. And my esthetician works with people to give them all kinds of pointers so that any bruising they would get is kept to an absolute minimum. So we have a lot of people come back a week after, and they're absolutely amazed they had no bruising.
Okay, now just like Botox, if you give somebody weak Botox, it doesn't work. You say that not everyone nationwide is doing the same solutions. That means the mix in which you inject the fat. Tell me about that.
Well, what it is there are 2 main components of the lipotherapy. Phosphatidylcholine, deoxycholate, a soy product, and a bile salt, something natural to our bodies.
So both of these are natural?
Yes, they are.
Okay.
And what it amounts to is the amounts of those 2 can make a difference in the effectiveness of the treatment. Also, the dispersion, meaning the spacing of the injections, the depth of injection, and the volume of injection can have profound effects on how it actually turns out. That's the art of it.
How about arms? You talked about arms. How well do they treat?
You know, that's funny you bring that up, because I had no idea how much that affected women. especially when it comes to those bat wings.
Yeah.
They were some of the first treatments that I did was to some women for the fat under their arms.
A lot of women self-conscious of their arms, you said.
Very much so. And this past summer was so hot in North Carolina as well as other parts of the country that the thought of going in anything other than sleeveless, I just can't imagine, and yet that's what these women were doing.
Yeah.
They've been putting emails to me, leaving messages, telling my other staff members they're wearing sleeveless for the first time in years to weddings and to all kinds of social engagements. They're headed to the beach in something sleeveless and in a bathing suit because they're not afraid to show their arm.
Dr. Hudak, we're going to take a quick break. We come back, we're going to meet one of your patients. In fact, why don't you tell us a little bit about the patient before we go to the break?
We're going to be seeing Tina Crew. Now, Tina Crew came to me as a referral from another friend, and Tina was pretty distraught because she had gone through, after having a baby and then having hypothyroidism, had gained a lot of weight. And having been in the cosmetic industry for 22 years, looks were very important to her, and it was really bringing her down, causing her depression. She wanted to do something about it. So she told me in my first meeting with her that what she was wanting to do over the course of the next year was to have a breast reduction and then to have a tummy tuck.
Okay.
And I said, Tina, hold on that tummy tuck. I've been studying something for about 5 years called lipotherapy. I'm getting some, I'm signed up from some really awesome training.
So she was headed for a tummy tuck.
Let me check it out for you. That's right.
And this lipotherapy did the job.
It did.
Okay. Well, we're going to meet her after this break. Okay. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, a patient that had the LipoDissolve procedure. We'll be right back.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
It is now clear that not only are nutritional supplements vitally important to maintaining good health, but studies show that they can help reduce the risk of and successfully manage many diseases. I've done my homework, and the nutritional supplements I take, give to my family, and recommend to my patients are from Designs for Health.
Designs for Health, the leader in professional brand nutritional supplements.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, a new injectable technique to dissolve or actually kill fat on your body. Okay, Dr. Hudak, we're going to meet one of your patients, Tina Crew. Mrs. Crew, welcome to the program.
Thank you. You can call me Tina.
Okay, Tina. Now, Dr. Hudak here says that you were going to get a tummy tuck. Is that right? Or
that is correct. When I met Debbie, I was very, very depressed and going through a very difficult time because
I have kids?
I have 2 children. I gained a lot of weight. I have the hypothyroid, which slowed me down a lot, more because of my fat than anything else. It has made such a difference in my life, I can't tell you.
So how many treatments, by the way? I mean, were you skeptical? Because, talking to Dr. Hudak, it almost sounds too good to be true. It seems so simplistic that you could inject a simple injection and dissolve or kill the fat.
Kill the fat.
Were you skeptical as well, Tina?
I believe in Debbie hudak so much that I can't even tell you. When she says something, it's going to come true, and it did. So I followed her lead, and it came out. It was incredible.
So did it remove a lot of fat? I mean, visually, you can see the fat?
Yes, about 5 inches off my stomach.
Is that right?
And it made such a difference in my clothing. I went to the beach for the first time and actually wore a bathing suit. Things I hadn't done, and especially for my children, not to be there in times of going to the pool or to the ocean was difficult. And now I go, and now I have fun, and now I'm losing weight because I'm actually doing activities.
Are you completed with the treatments?
No, I'm not completed yet. I'm still in the process. I still have some more to go, and probably another maybe 1 or 2 treatments on my stomach.
Now, Doc, now is this the typical patient?
This
40-plus woman.
Yes.
Couple of children.
Mm-hmm. She's the typical person in the abdomen will need generally about 3 to 4 treatment sessions total. There are people who have just a little bit of fat that even 1 treatment session might do it, but more likely it's going to be 2 to 3 treatments.
And Tina, let me ask you this: what about pain?
In the beginning, it hurts. And after a few days, your pain goes away, your swelling goes down, and you start seeing the difference.
Was it worth it?
It was definitely worth it. It's made a huge change in my life for me and for my family.
Does it raise your self-esteem? Dr. Hudak says that it changes people's lives. Do you feel like?
It's definitely changed my life, and all for the better.
So Tina, let me ask you, and we're out of time here, but if somebody's watching this and they are skeptical like I am about this lipotherapy, what do you say to them?
Lipotherapy works. I'm a perfect example of living proof of what it does to change your life and to change your body and make things positive for you.
Okay, great. I want to thank you so much for coming on the show.
Thank you.
We're going to meet your staff, the people that actually do some of the, what do they do? Consultations with you? What is it?
We have our office coordinator, Kathy Strife, who answers the telephone and does an initial screening for people, letting them know after she asks a few questions if they likely are a candidate or if they're going to have to do something like lose some weight, go on a diet.
So not everybody gets this lipotherapy?
No, to get the most bang for the buck, you want to basically be down to your true frustration fat.
So when you just can't get rid of that last
stuff. No matter what you're doing with your diet and exercise, this is what's going to take it away.
Will this replace liposuction someday, in your opinion?
Oh, absolutely. It's been called next generation liposuction for some years.
Hollywood has adopted this.
Yes.
And big talk out there.
And like they've been doing this in Europe for years and years. You know, it started in 1952.
Now I understand liposuction, the procedure is the #1 surgery performed, cosmetic procedure.
That is correct.
You think this will also?
Absolutely, because more and more people are demanding to have no downtime procedures. And this truly is a no downtime procedure.
So what's the first move? I mean, what's the first step?
Well, the first step is for somebody to call on the telephone. And the person that they are most likely to speak with is somebody who I brought to the studio here so that you could see her.
Why is that important? You wanted them to meet your staff.
It's nice to see a familiar face. You know, when you go and you see something on TV and then you go to the office and you can recognize right away. There's a sense of familiarity.
Okay.
The other thing is, I'd really like people to know that I've handpicked the most incredible, very warm, caring, competent.
It can be intimidating, by the way, going into a place that does cosmetic procedures.
That's exactly why you have to choose people carefully.
Okay.
And we have, Kathy and I have been working together for 8 years.
8 years. Okay. Kathy, welcome to the program.
Hi, thank you.
Now, Kathy, what is your role? You're patient coordinator, is that right?
Correct. I am at the front desk. I answer the phones, screen calls, make appointments for Debbie.
Kathy, is this a happy group of patients?
Yes, they are.
Now, is this becoming a very popular procedure? A lot of questions on the telephone about this procedure?
Yes.
And what are they, by the way? What are the frequently asked questions you hear?
Most people want to know how many treatments, of course, how much is it going to cost? Does it hurt? Is it real? Does it really work? That's the question most people are asking.
What do you tell them? Does it work?
Yes, absolutely. I'd say probably over 90% of our patients have gotten results from it. I think everybody's always nervous when they come in because they're thinking, okay, this is really going to hurt. And when they realize, afterwards they realize, hey, that wasn't really bad. And then once they start getting results, they're like, oh my gosh, it was worth it.
And the type of pain that we're talking is generally an extra strength Tylenol type of pain.
Oh, that's it.
That's it.
Okay. So when they call, they make an appointment with Kathy.
That's right.
Kathy, and I want to thank you for coming on the program. So what do you say to somebody that's skeptical? But they want to know their options, obviously. Is that where it starts? Just find out your options if you're a
Absolutely.
candidate?
You want to have all of the options put out in front of you, so you know what the pluses and minuses are of each one.
Kathy, I want to thank you for coming on the program.
Thank you, Randy.
Now, you brought another one of your staff.
I did.
Your esthetician. Tell me
Yes.
about her. It's Michelle Serra.
That's correct. She's absolutely fabulous person. Wonderful, warm, and bubbly personality, extremely knowledgeable about mesolipotherapy.
Michelle, welcome to the program.
Thank you very much.
Now, your title, you are a licensed esthetician. You are the lipotherapy consultant.
Yes.
Tell us your role there.
Well, basically, the patients come in for a consultation. I sit down and go over all the before and after pictures with them, showing Dr. Hudak's work.
Now, you've had the procedure as well. Is that right?
I have, on my lower abdomen.
Are you pleased?
I am, very much.
Now, of course,
so.
you're going to say she's pleased, right? But you really are pleased.
I really am. I had a lot of skin tightening.
Were you surprised with the results?
Yes, I was surprised. It was better than I expected.
She's actually the perfect candidate because it seems, even in the case of Michelle, even in the case of many people who are very seemingly fit, almost everybody has at least one area of frustration fat.
Right.
Little localized area of fat. They cannot, yes, no matter what they do with the diet and exercise, won't budge.
Now, what about these patients? Very happy. I mean, you do a lot of procedures in that office.
Absolutely.
Would you say this is the happiest group, or the blepharoplasty, the filler group? What's the happiest group of patients you found?
Ooh, that's a tough one because we have patients who have lipotherapy and see some of the work I do with lids and with injections of fillers or Botox and want that, and vice versa. I don't know that I can say one group's happier than the other, although I will say this about it. I haven't had any procedure in which people have said it has so dramatically changed their life and their lifestyle. People are going back into the gyms because they finally got rid of that fat that they got disgusted and tired of working and dieting. Couldn't get rid of it, said the heck with it. I inject them, they lose it, and they're back in the gym because they just feel like they have a whole new lease on life.
Michelle, is that what you're finding as well?
Yes, it is.
You're probably in a better position because the doctor does the procedure, and then they see them on the follow-up quite a bit, probably.
Well, actually, in the first 72 hours, I call the patients, every single one of them, back personally. And they have access to my personal cell phone, so they don't even have to go through an answering service.
Tell us about Dr. Hudak, by the way. Patients like her?
She is fantastic. Everyone loves her. She's so thorough with everything that she does. She's very nice. They all feel very, very comfortable.
Now, she's a positive, happy person. Is she always like this?
Yes, always. Always.
Is that right? Okay, well, I want to thank you for coming on the program.
Thank you very much for having me.
We are completely out of time. And I want to talk about your eyes, what you're doing for the eyes. But by the way, everything we've talked about as far as your before and afters, and we'll show some on this program today, but they can go to your website.
That's correct.
And see the before and afters. That are I've seen them. Pretty dramatic with just, some of them look like liposuction, but it's just a simple injection. Is that right? Now, your eyes. Tell me about eyes.
Well, eyes was the area that I specialize in as far as facial surgeries go, brows and upper lids and lower lids. And I do not only the cosmetic procedures, but also the reconstructive work.
Okay, okay. Now, who's your typical patient that comes in? And we're talking about just the saggy skin over the eyes. You also say that the brow lifts are being possibly overdone.
Oh, I agree. There's been research and there have been articles in the last 2 years done through the American Academy of Cosmetic Surgery that I'm a member of that have shown that the majority of physicians doing brow lifts are unhappy with the results 3 years later. And it's because they come down.
But what about that skeletal look? When I think of removing skin, I see these people sometimes on the news. They end up looking older because they have a hollow look.
They've removed too much fat, quite frankly.
Okay.
You have to realize that
too much skin.
Fat will atrophy some with time in the areas of the orbits.
Okay.
Fat atrophies due to disuse of the tissue in the area. And what happens with us is we get older, for some reason our eyes don't move as much, we just don't roll them around, and the fat starts to atrophy. So you have to be very, very careful to take into consideration.
So less is more sometimes?
Yes, and you want to take into consideration the age of the patient. If you have an elderly patient, you might be able to get by with being a little more aggressive in removing that excess fat. If I have somebody in their 40s or 50s or 30s, I'm going to be a little bit more ginger. Also, this is where the esthetician is key, because having healthy skin is going to give them a far longer lasting surgical result. So hopefully they won't ever feel the need or desire to have it repeated.
Final message, somebody, and back to this lipotherapy or lipodissolve or mesotherapy. What is it you're calling it?
Lipolyze is my particular formulation.
Lipolyze. And you've got this secret sauce, you say, where it gets better results.
You have to realize that before I went to medical school, I worked in 2 pharmaceutical companies in chemical quality control.
Okay.
And so I have a big background in chemistry. And what I found out in studying various different scientifically produced journals, dermatologic surgery and some others, that when they were changing out the amounts of deoxycholate and phosphatidylcholine, they could get various amounts of death of the fat cells. They could regulate it.
And these are the ingredients of what you're injecting to remove the fat.
But those same ingredients, too much of them can cause certain side effects, increased nodules, increased pain, things like that. So I've basically worked and taken 2 formulations that are in common use, tweaked them 3 times, and I'm working on a 4th time more. And that's why I'm getting results faster.
Okay, what do you say to the person watching this? Exercise isn't working. They're skeptical. Where do they begin?
Please come on in, talk with Michelle. You're absolutely going to love her. Let your eyes be the real judge of the before and afters. And we have plenty of patients that are happy to give testimonials on how it has affected their lives.
And if the patient wants to meet with you one-on-one, they can?
No problem. Absolutely.
Okay.
I'm always available to my patients.
And you even give your cell phone, I've been told,
That's
to patients.
True. That's true. For the first 72 hours, I give it to them, and I usually call them with between 48 and 72 hours after their treatment, just to make sure that they're doing okay and if they have any questions or concerns. And I invite them and I encourage them to give me questions on the cell phone at any time of the day or night.
Okay, now with this lipo technique,
yes,
big learning curve, steep learning curve?
It all depends on if you went to the right people in the first place. Yes, there's there's a talent curve. You got to have a certain amount of talent, to do this. You also have to be able to visualize where you want the fat reduced, where you want more skin tightening, to know the proper depth, volume, and spacing of injections. All that comes into play.
And the skin comes back. We didn't talk a lot about that, like a saggy arm.
It actually thickens. That's been proven again through...
So the skin can actually tighten?
Yes, through pieces of skin in which they injected the person in the abdomen, did an abdominoplasty. They have shown not only is the fat dead, but the skin is tightened. There's more elastin and collagen, and it's actually thickened. It is healthier skin.
And jowls and necks, great. Great area.
Absolutely.
Great area. Okay, well listen, very interesting. I want to thank you for coming on the show.
Well, thank you for giving me the opportunity.
We'll have to have you back. Good.
Be great.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.